Assalamu alaikum. Welcome back to my channel. Today our topic is masses and tumors, normal variants and artifact source of false positive findings. The echocardiography evaluations of intracardiac masses is critically dependent on the ability to distinguish normal from abnormal findings. Ultrasound artifacts are common even in high quality studies and may be mistaken for pathological conditions. Near field clutter and reverberation are examples of artifacts often confused with pathology like apical thrombi. Anatomical variants are present everywhere, may involve any chamber, are well structured, and are potentially confused with pathological structures. Here is a list of normal variants in the right atrium, which is GRE network, ostation well, cresta terminalis, catheter pacemaker leads are and fatty material around the tricuspid annulus. Let's watch one by one. Look at the right atrium, you can see a web-like structure which is a normal variant and called as GRE network. GRE network is refers to a filamentous web-like structure in the right atrium that results from incomplete resorption of the embryonic sinus venosus, and it is a common anatomical variant. Now you can see in this image a ridge-like structure near to the IVC. This is ostation well, and the ostation well, also known as the well of the inferior vena cava, is a ridge of a variable thickness in the inferior right atrium, and it is a remnant of a fatal structure that directed incoming oxygenated blood to the foramen well and away from the right atrium. So this is a normal variant in the right atrium. Now another normal variant in the right atrium, as I have seen in the many patients. This is called cresta terminalis. And cresta terminalis is a ridge of myocardium within the right atrium that extend along with the posterior lateral of the right atrium between the orifice of the superior vena cava to the orifice of the inferior vena cava. Now look at the right side, you will see another normal variant which is look like a wire in the right atrium and the right ventricle. You can observe these things and post procedure of maker. So this is a pacemaker wire which is showing in the right atrium and the right ventricle. So this is a normal variant, not a pathological. Look at this image, you will observe a round like structure, a round mass like structure, and the tricuspid annulus. So this is called a fatty infiltration around the tricuspid well annulus, which is often confusing with a mass or tumors. So this is a normal variant, not a pathological structure. Now, in the left atrium, normal variants are calcified mitral annulus, coronary sinus, ridge between left upper pulmonic vein and left atrial appendage, and the pectinate muscles. Now, in normal variants of the left atrium, as one of them as a calcified mitral annulus, so you will see as a shining and the mitral valve posterior leaflets. So this is calcification, which is a degenerative process in the patient. But this is in the posterior leaflet, not in the annulus, but you will observe at the annulus of the mitral leaflet also. So this is a normal variant in that type of patients, not a benign or tumors, etc. This is another normal variant of the left atrium, which is called coronary sinus. So this is a normal variant, not a pathological conditions. Look at this structure in the left atrium. This is called commodian ridge or warfarin ridge, a normal prominent anatomical fold in the heart left atrium separating the left atrial appendage from the left superior pulmonary veins. This is not a disease or caused by commodian. It is an embryological remnant that can look like a mass or clot on an echocardiography, leading to misdiagnosis. But advanced imaging confirm it is a benign part of the heart structure. Here you can see a comb-like muscle ridges in the left atrial appendage. This is pectinate muscles. So this is also a normal variant, not a clot or mass in the left atrial appendage. Now the right ventricle normal variants is moderator band, muscle bundles, tribulations, catheters, and pacemaker leads, as you watched earlier in the video. In this clip, as we see the warfarin ridge of left atrium, and as a normal variant, we also see the right ventricular moderator band and septomarginal tribulations. The moderator band is a muscular bridge in the right ventricle of the heart connecting the intraventricular septum to the base of the anterior pupillary muscle. Crucial for carrying right bundle branch fibers, ensuring efficient electrical conduction and preventing overdistensions and supporting the tricuspid valve apparatus, serving as the key anatomical landmark for identifying the right ventricle, especially in congenital heart defects. And this is another normal variant structure in the RV, the pacemaker wire. Normal variants of left ventricle, pupillary muscles, left ventricular tribulations, and false cards. This is the external short axis pupillary level window. Here we can see the two pupillary muscles, which is look like a round mass or a tumor, often confusable in the abnormal variant. So this is the normal variant, normal structure of the left ventricle. Another clip of the pupillary muscles, the two round mass in the mid LV, which is resemble like tumors or clots. So these are the normal variant of pupillary muscles. Unfortunately, the patient has an atrial fibrillation and the LV apex look like filled with layered thrombus. But these are tribulations, which is a normal variant and sometimes interpreted with thrombus. Look at the bridge between the septum and the lateral wall. This is a false tendon or false cards. This is a normal variant of the LV. As we discussed the all normal variant structure of the heart is often confusable with the abnormal pathology. Now we will going to the primary tumors. Echocardiography is a useful to identify condition in which masses may develop as an accurate techniques to detect and characterizes masses once they occur and provide an non-invasive means for surveillance after treatment or removal. Most tumors in the heart are the result of direct spread from adjacent malignancy or metastatic disease. Primary cardiac tumors account for a small percentage of the total number. Primary tumors can be either benign or malignant and can occur in all group of ages. Here is a list of cardiac tumors, benign and malignant. The most common benign cardiac tumor is myxoma, which is 30% of the total cardiac masses are tumors. Lymphoma is 10%, pupillary fibrosarcoma is 8%, rhabdomyomas is 6%, and this is the rhabdomyomas in found in the children, the feeds, not in adults also, and the fibroma, hemangioma, teratomas. And malignant tumors are angiosarcomas, rhabdosarcomas, fibrosarcomas, mesothelioma, lipoma, and leiomyosarcomas. In this clip, you will see the mass attached to the atrial left atrial septum, highly mobile with a thin stalk attached to the atrial septum. This is myxoma. This is a small one. I will show you a large myxomas also. These are much bigger to create a functional MS blocking the inflow, left ventricular inflow. 75% are grows in the left atrium, 15% are grows in the right atrium, and 5% in the each ventricles. These are mostly benign tumors, which is grows in the heart. This is another example of myxoma, atrial myxoma, highly mobile mass attached to the left atrium septum. This is a huge one, huge myxoma, large myxoma, protruding to the LV and blocking the left ventricular inflow, creating a functional MS. So this patient has symptoms of breathlessness and dizziness and chest pain. Get this mass in the left atrium cavity, a fixed mass, but the differential is and this and the myxoma is that the myxoma has a specific location attached to which is attached to the septum and stalk within a highly mobile, but no mobility in this mass. And because in this patient they have mitral stenosis, so this is a thrombus in the left atrium cavity. This is not a myxoma, and this is by the location. This is not in the atrial septum. So this is a thrombus due to blood stasis because there is a severe mitral stenosis. This is not a myxoma. Look at this. This is a huge, very big mass and the left atrium attached to the left atrium septum. This is also myxoma, which is creating a functional MS. Look at the mitral valve. They are going through the mitral valve to the LV and look again in the four chambers. This is very huge. So this is also myxoma in creating a functional MS. At the right atrium, multiple masses are protruding or mobile masses seen in the right atrium. And look at the RV shape. The free wall is akinetic with the apical sparing. These are a Mecolian sign leading to uh, pulmonary embolism. But here the thrombus, the mass is in the right atrium. So these are the thrombuses are clots in the right atrium, which is going to the right ventricle and the pulmonary arteries. So these are not myxoma or other masses. These are DVTs or thrombosis. This is also a myxoma in the right ventricle. As you see, this is going to the main pulmonary artery sites. Another primary cardiac tumor is fibroblastomas. As you see in this clip, fibrobblastoma is attached to the tricuspid anterior leaflets. Papillary fibrobblastoma accounts for approximately 10% of all primary cardiac tumors. They are usually found in older patients and arise from either the mitral valve and the aortic valves and sometimes from the tricuspid valve. Papillary fibroblastomas are small, generally from uh, zero point 0.5 to 2.0 centimeters in a diameter and are often confused with vegetations. Making this distinction is difficult because of the similarity in the echocardiographic appearance. A correct diagnosis on their part depends on the clinical settings, that is, the presence or absence of the infections. These tumors usually attach of the well by a small pedicles and with a delicate frown-like surface, and mobility is common. And another primary cardiac tumor is rhabdomyomas. You see in the image is multiple masses in the RV and LV. Rhabdomyomas is the most common cardiac tumor in children. They occur within the cavity or embedded within myocardium, usually small and multiple. As you see in the image, these are multiple masses and often regress on their own. The four chamber transesophageal image you see in the LV apex, there is a huge mass uh, seen. This is a cardiac fibroma, the primary cardiac tumor. A cardiac fibromas appears on echocardiography as a well-demarcated, solid, and highly echogenic intramural masses. As you see in the image, the mass is highly echogenic. These non-contractile tumors often display heterogeneous echogenicity and may contain calcifications. They are frequently seen in pediatric populations and can cause obstruction and arrhythmias. To evaluating cardiac tumors, key assessment criteria include locations, attachment, size, and shape. By these locations, you will identify the mass nature. Look at the right atrium, huge mass seen by the location of attachment. This is suspected by renal cell carcinoma. Two cardiac tumors, although rare, carry a significant clinical importance. Accurate echocardiographic evaluation allows us to differentiate true tumors from thrombus vegetation and arteries, which are crucial for correct diagnosis and management. Always remember location, attachment, mobility, and echogenicity are key flaws. Echo is not just an imaging tool, it is a decision making guide. I hope this lecture helped you understand cardiac tumors in a simplified and practical way. Thank you for your time. Keep learning and keep exploring echocardiographer, and we'll see you in the next lecture.